Okay, this video we're going to talk about cerebral aneurysms. Now, cerebral aneurysms are rare, but they generate a lot of emotional excitement. It's kind of like people living on the coast worried about a shark attack. Actually, a shark attack for coastal people would be much more common than problems related to cerebral aneurysms. Excuse me. The reason why I talk about it is because I get asked about it a lot. I have to read a lot of films with regard to concern for cerebral aneurysms. And so just to put something in perspective, in the past 2 years, I've seen zero patients die from cerebral aneurysms. Okay, I'm a neuroradiologist. I look at the brain all day long, every day. And it's rare that a person has a bleed and die. It's also true a person could have a bleed and die at home and we don't know about it, okay? But it's rare. Most of the potential aneurysms I see are actually false positive. There's a question of a bulge in, the anterior communicating artery. We call it the ACOM, or at the origin of the posterior communicating artery. We call it the PCOM. This, by the way, is a circle of Willis. Willis is the person who described it. The arteries at the base of the brain make a circle, so that's why it's called a circle and named after Willis. Okay, this is the internal carotid artery here. Internal carotid artery comes up into the brain, bifurcates into the middle cerebral artery and the anterior cerebral artery. The anterior cerebral arteries from both sides run close together, and the communicator is the connecting artery. Anterior communicating artery, you can also call it the anterior connecting artery. Posterior communicating artery travels posterior to the posterior circulation from the basilar artery and connects up with the posterior cerebral artery. So anyways, that's the anatomy, and I'll get to the more interesting stuff here in just a moment. Just show you what an aneurysm looks like. So here is an aneurysm on the right side. It's just a bulge in the wall of the artery. You can see there's nothing over here, and there's a big bulge. That's an aneurysm. So I spent a significant amount of my time looking at these little pictures. This is a magnetic resonance arteriogram, MRA of the brain. Just looking, is there an abnormal bulge in these arteries? So you can see this would be the A1 anterior cerebral artery over here, A1 anterior cerebral artery, A1 on the left side, A1 on the right side. It's all as if the patient's feet are towards you. Here's the middle cerebral artery, M1 segment, and then when it bifurcates, M2 segment. This is from this article here. Okay, go to the next slide. All right, so what I'm basically saying is, like I said, I haven't seen a single person die from an aneurysm or a subarachnoid hemorrhage in the past 2 years. All right. Yes, I've seen plenty of them in my career. You see a lot more of these if you work in a giant, big city program where they got a bunch of catheter interventional radiologists, neurovascular aneuroradiologists, and a bunch of neurosurgeons specializing in vascular neurosurgery. They'll see a lot more of these because they have a big feeder referral population. But I'm making the point again, it's uncommon. All day long, I'll see a bunch of patients demented, dying, and dead from diabetes and high blood pressure. Okay? All day long, every day. That's the stuff you should worry about because that's what kills the vast majority of patients, makes them demented, plugs up the arteries in their heart, plugs up the arteries in their Johnson, etc. Non-stop. If a hospital only took care of patients that were pre-diabetic, diabetic, or hypertensive, that hospital would be super busy all day long. If a patient only took care of aneurysm patients, it might have, hardly any, almost never have any patients, okay? Now, I do occasionally, get asked or get a phone call about patients with aneurysms, and I can tell you most of them are false positive. They end up just being tortuosity or normal variant, what's called infundibuli. Infundibulum means like a funnel, dilation at the origin of an artery, like the posterior communicating artery. Most of the ones that truly are aneurysms are very small. They get followed for years and they never bleed. But there are some that are bigger, especially when they start getting over 7 millimeters or so. There's an increased risk of bleeding. They'll sometimes open up the skull and put a clip on them. That's a craniotomy with clipping. Or they'll go up through the artery into the brain, transcatheter, and they'll place little coils in there to thrombose the arteries off. There can be side effects from those procedures, morbidity and mortality. So you would only do it if the bleeding risk was significant or if the patient had already bled. There's some things will increase the risk of having an aneurysm, like polycystic kidney disease. These are rare conditions. Ehlers-Danlos, FMD, fibromuscular dysplasia. And once a person has an aneurysm, certain things can cause a small increase in the risk of it bleeding. If they have really severe hypertension, if they're smoking cigarettes, if they're an alcoholic, if they're on blood thinners. Okay, but again, it's all, like I said, it's quite rare that I'll see a subarachnoid bleed. I see lots of intracranial bleeds, mostly from trauma and from severe brain atrophy in older people. Older people falling down all the time, hit their heads. Most of the time, nothing happens, but I'll see bleeds from that every week. Let's see. What else? Usually you'll get an MRA for some other reason, like a stroke workup. There'll be an incidental possible aneurysm. Then they get a CTA, computerized. It's a CAT scan arteriogram. It's more accurate, especially for looking at the common spots of normal variants than is an MRA. But you don't routinely do a CTA for that because there's radiation and intravenous iodinated contrast. And what would I do, me personally? I'm not worried about it, okay? I'm about as worried as a shark attack. I don't ever swim in the ocean, so I think it's pretty unlikely I'll get bitten by a shark, all right? The risk of having one of these things is so small, it's infinitesimal, so I would not worry about it. What I worry about is, obesity, diabetes, hypertension, cancer, those types of things. I'm not worried about obesity, diabetes, hypertension. I've prevented that completely with the low-fat vegan diet. And my risk of cancer is diminutive. My biggest risk is probably annoying somebody who'll beat me up for being so obnoxious about the way I question everything. Okay, but, I'm thrilled about this low-fat vegan nutrition stuff. It's finally found a pathway out of all these diseases. Okay, anything else to say about this? Oh, once an aneurysm is found, it's going to be followed very closely. The American medical system, it's very worried about medical legal stuff, so it's not going to let anything slip through the cracks. It tends to be very aggressive. As soon as the person reaches a threshold, there'll be an incentive to treat, because if the patient bleeds and they didn't treat it, they'll feel like, they were responsible. So there'll be the tendency to be more likely to treat than not to treat. So one of the things I do is I try to just not volunteer for any type of screening study that I could avoid if possible. Because what people don't understand is everything depends on pretest probability. If you have a very high likelihood of pretest probability of having a problem, it makes sense to check for it. But if your pretest probability is low, then you just end up with tons and tons of false positives. You get all these unnecessary workups and all the morbidity and financial expense that goes with that. For what? Okay? The money is avoid obesity, diabetes, and hypertension. That's where the money is. That pays off an incredible amount. And so anyways, hope that's helpful.